Hello, good morning, guys. I'm Dr. Prince Rawat, and I have started a series where I will tell you the most important and most repeatedly asked topics in FMG exam which you cannot miss. I have already finished some of the subjects, and today I will start with the psychiatry subject. Psychiatry is again very short subject. Only 2 to 5 question is asked, okay, but still it is very important. It is very easy. You can score this 5 marks as well, 5 to 10 marks actually. Sometimes they ask even more question as well. So without any delay I will start. And the number one topic which they every time ask is alcohol withdrawal. What are the symptoms of alcohol withdrawal? What is delirium tremens? Every time there is one question about this, either alcohol withdrawal, or there could be opioid withdrawal, or that could be any toxicity, or they can ask you about which drug will you use to control alcoholism. Also, which drug will you use if there is symptoms of alcohol withdrawal. Then the second topic is schizophrenia. Schizophrenia, again very important topic. It is you have to read about the criteria, how long the symptom should last, so that we can diagnose it is schizophrenia. What is positive symptoms, what is negative symptoms, also what risk factor they have for schizophrenia, and what could be the complication of schizophrenia. What is the management of schizophrenia? Very important topic. Do not miss this. Read about it very carefully. Then they will ask you a question about postpartum blues versus depression. Postpartum blues versus postpartum depression, again very important. There is one question, either they can ask in the favor of OB/GYN, or they can ask you in psychiatry. Read about it. Then they will ask you a question about eating disorder. The most favorite drug in psychiatry is lithium. You read about the use of lithium, what is the side effect of lithium, where you cannot give lithium, where it is contraindicated. For example, if a mother is pregnant, then you cannot give lithium, it is contraindicated in pregnancy. What is generalized anxiety disorder? Then what is obsessive compulsive disorder? You should know what is the difference between delusion, what is the difference between depression. Then they can ask you, they can give you like a patient is coming and they are having bad thoughts regarding a god, or they want to have sex with gods. This is also a psychiatric condition, so you have to read about it. Then you have to read about trichobezoar, what is labile indifference, what is Frigoli syndrome, what is Capgras disease syndrome, sorry. Then you have to read about the pharmacology of psychiatry. It is very important. What is SSRI, what is SNRI, in which condition you cannot give SSRI. For example, in OCD you cannot give SSRI, okay. It will have a negative impact on the patient. Then this is the very important topics, and in psychiatry generally they ask from this only, nothing fancy about it. They can ask you a little bit of definition, what is impedance, then disorder of thought, then this kind of question only, which you will read in your main notes. It is very basic stuff. They can ask sometime the question about MSME examination also, so read about it as well. But this topic which I have told you, mark it in your main notes or in your revision notes, because this is very repeatedly topic. Every time in FMG exam they have asked question on this only, so I am expecting there will be a question from this, and you will not make them wrong. Right now you only have 3 months of time. Read very carefully and make a proper timetable, and this topic will be very helpful in your last 10 days revision, because they are very short and this is very high yield. I will keep making these videos. The picture for this topics is already in my Telegram group. The link for the Telegram group is in the description. Follow my YouTube channel, because I will keep making the videos for all the 19 subjects. Thank you.